Lin,
Go ahead, subscribe all of you.
are you ready?
Hello, can you hear
Hi.
me?
Yes, I can hear you. Can everybody hear Dr. Lin? Please type yes in the chat room. Okay, great. Okay, before we start, I want to let you guys know that the patient expressed to us that he has been having a lot of left arm pain and numbness. He said he's under a lot of stress right now because of the family. And he said that, is that why my pulse on the left is indistinguishable? And he said, this is how he felt before his last heart attack 12 years ago. Like the whole arm feels numb. He also has chest pain. So Dr. Lin,
Yes.
can you tell us where do we begin with this patient? Because his tongue, his pulse are so different. And also, I don't know, he looks like he might have another heart attack. What is your Chinese medicine diagnosis? Please enlighten us.
Okay. Yeah, I think Diego, this case is a little bit more complex than before program. But I think actually it's very common in clinical practice. Actually, it's not everybody. It's very simple, just like a textbook said, and we can just make an easy diagnosis and the prescription. So I think today's case is a very good chance, very good opportunity to learn how to analyze the really common case in clinic. And just like Tina said, how can we make a choice where and how to involve in the first step, okay? So in my opinion, first one about Diego's left arm, sorry. I think it's not only focus on the internal medicine, internal issue or the heart problem, but also we need to check his shoulder, neck, and rotator cuff muscle, because there are two nerves get through from the rotator cuff muscle group, just as people knows the radial nerve and the ulnar nerve. Okay, so most of time people feel numbness or weakness around the arm. You cannot just focus on their cervical spine. We cannot just focus on, okay, the cervical nerve plexus problem. No, because the nerve innervation is just like a pathway. Every part of this pathway can be affected, muscle activity and the feeling. So most of the time, if you can make sure the cervical spine alignment is okay, you need to focus on the, for example, supraspinatus, infraspinatus, teres minor, and the teres major, and the subscapularis. Sometimes also involved by deltoid and the triceps, because no matter ulnar nerve, radial nerve, even axillary nerve comes from that areas. So no matter you are a physical therapist or you are acupuncturist or you are a chiropractor, don't forget, check the pathway, not only from the origin. Okay, so about Diego, if we like to focus on the structure, we need to focus on, first one, make sure the cervical spine is okay. The cervical alignment is okay. Not tilting, not rotate, and make sure the alignment. Second, make sure the shoulder part, okay, trapezium, supraspinatus, infraspinatus, and I forget how to say that muscle in English. 大小菱形肌,
No, I don't know either.
Oh, okay, got it. Okay, I'll figure out and talk about it later. Okay, and the outside part, teres major, teres minor, and under scapula, subscapularis. This muscle is very important for the shoulder movement. Okay, so we need to make sure the bone structure is okay. We need to make sure that all the muscle groups are good. And if you fix all the proximal part, but patient feel, oh, okay, it's better, but it seems like a little bit of something wrong. There is something wrong. You need to check their elbows. Okay, you need to make sure elbow joint is on the same alignment and from proximal to the distal. So shoulder, elbow, wrist, even sometimes even the palm bone, the carpal bone, I mean, you need to check them. So no matter the case like Diego or some patient have the stroke, the body paralysis or weakness or high tension, no matter any cases like this, you need to make sure from proximal to distal, you need to check them, okay? So you can make a list for first step. After the adjustment, you can do the acupuncture. Then after that, people will feel better. Then they have confidence with you, then you can make some prescription for them. Okay, so that's the first step. And second, yes, just like Tina said, I also have a little bit of worry about Diego's condition, about the heart. Because about the pulse taking of the left side, most of the time we say left side, we observe the blood. The right side is opposite. We observe the qi and the yang condition, right? Mm-hmm. So about the pulse taking today, we can see the Diego's left side pulse is so weak. You almost cannot touch the movement, right? Mm-hmm. So we can make an assumption. Diego's yin and blood deficiency is very
severe.
Very severe. So this one connected my prescription. About the formula, one of the formula of in the prescription, I give him 炙甘草汤. Okay, and about the right side the pulse, even Tina take the pulse can see tight, worrying, sleepy, forceful, but I think that's because of first one, he feel stressful or he feel pain. So let's the mental condition can affect the pulse change, right? So the right side seems very forceful. Seems I can touch the movement very easily. I don't think that means Diego's yang is very strong. No. The pulse feeling because of his mental condition. Sometimes some aspect comes from the mental. Some aspects comes from the Western medicine he take. So when we do the examination, we will ask many questions we will get some information from patients. And we also need to know, does the patient take any Western medicine? Especially if patient take a long time medicine, we need to know what kind of the medicine he take and make sure the side effect. So the pulse taking is not so easy just after we take this, okay, we know what happened. Because there are many factors can affect the performance of the pulse. Okay, so Diego has a serious problem about the yin and the blood deficiency. So that's why I like to give him the 炙甘草汤, okay? And this patient is so complex. But the TCM practitioner face the complex problem. Most of the time, we like to make the complex back to the simple. I mean, we need to find some principle to deal with this problem. And the treatment process, we have some steps. So you don't need to think, okay, this is the first visit. I will make a prescription to cover all of the problem. That's not possible, okay? Especially in this case, more complex. So we need to have two principles in our brain. We need to make it stay in our mind. First one, we need to find the main problem. Maybe it's just only one. Maybe there are 2 or 3 main problems. And between the problems connection, many disease or symptom can show on patient's body. So first one, we like to make sure what kind and how many factors is the main problem. The second is we don't be panic for all the symptoms. People always say many things from top to bottom, right? Mm-hmm. So the mission we need to do is just make sure all the symptoms, is there any relationship between all the symptoms? Just like I said last time. So the main problem, first one, the in and above insufficiency. Second, this patient has a bad habit about the diet. He likes drink the cold water, or he like the low temperature thing. So everybody knows, every TCM practitioner knows the low temperature, the cold can affect the blood circulation, can hurt yang of the heart and kidney, can make our body decrease the physiological pathway and make people feel tired, okay, and feel your musculoskeletal system become tight or pain. So about Diego's, no matter the fibromyalgia or arthritis, I think under these 2 diseases, the factor is the same. The cold, a little bit humid, I mean damp, under the skin and in the joints. So the second one formula I would like to give Diego is 桂枝芍药知母汤. Okay. Today, if we write the traditional prescription, I can write the single herb 1 by 1 and make sure every single herb's dosage, right? But now most of the time we like to use the concentrate herbal medicine powder. So in this condition, I will accumulate all the information and make sure the direction I like to prescription. I do the prescription. So I don't write a single herb in traditional way 1 by 1. I pick up the similar formula, put it into the prescription. Okay, so the 桂枝芍药知母汤, I think most of the TCM practitioner like this, know about this formula, right? It's a variation, comes from the 桂枝汤, okay? So this formula, it can expelling wind and damp, right? And warming the meridian can, increase the blood circulation and dispelling the cold. So it can make the yang become stronger and can also nutrition the yin, because there's the 知母 in this formula, right? Okay. So the second formula I like to give Diego is 桂枝芍药知母汤. Okay. The other part are single herb. First one is 治附子. Actually, in 桂枝芍药知母汤, there is 附子 in this formula. Why I add more 附子 in the prescription? because the pain symptom. Okay, so Diego is worried about the pain, and he has stressful feeling every day because of the pain, the uncomfortable feeling. So we like to decrease the pain feeling in the quickly. So I add more 致附子. 致附子 can warm the meridian and can make the blood circulation fast because it can stronger your heartbeat, right? So it can remove the cold from the joint quickly. So that's why I add more in the prescription. And the second single herb is 当归尾, the tail of 当归. We know about the 当归, it can nutrition your yin and blood, but the effect of the nutrition not just like the 地黄, just directly supply the blood and yin. The 当归's effect is make the blood flow back to smoothly. Under this effect, increase the blood nutrition. Okay, so it's an indirect supply the blood. So we need to make very clearly identification between 当归 and 地黄. Okay, that's different for blood or yin supply. Okay, so I use the 当归尾. It can can just like pushing other formula effect faster and just like bring or push the medicine to the distal part of extremity and the joints. Okay, and the last two single herb are 丹皮 and 桃仁. 丹皮 and 桃仁 is 丹皮 and 桃仁 are for the stagnation of the blood, right? So these two can make the blood flow smooth and correct the stagnation of blood. Maybe you will say, okay, these people take aspirin, right? It's a medicine for blood think, right? Why you add more 丹皮 and 桃仁? If you put the medicine like this, will make the blood too thinner or make the blood flow too fast? Is that good for his heart or vascular system? Okay, I like to answer this question is, the Chinese herb can, make the blood stagnation better. The mechanism is not really the same like Western medicine, aspirin or some medicine like that. Okay, so I still keep these two single herb in prescription because these two single herb can combine with 桂枝 in the 炙甘草汤 and the 桂枝芍药知母汤, and there is 芍药 in 桂枝芍药知母汤. So it's just like 桂枝茯苓丸, right? It is a very good formula, can correct the blood stagnation. In the clinical practice, we need to know the chronic problem, especially like Diego, the blood circulation become worse because the past history is so long. Okay, and he got the heart-related problem when he was young. So we need to consider about the microcirculation in your belly, in your chest, and in your extremities. So I use a low dosage 丹皮桃仁 to, accompany with other medicine and formula to, at the same time, we can increase the yin, we can supply the yang, and we can also make the blood circulation good in every part of his body. So the total prescription I like to give him, I like to say this again, including the dosage. 炙甘草汤 6 grams every day. 桂枝芍药知母汤 the same, 6 grams every day. 致附子 1 gram. 当归尾 1.2 gram 单皮 and taurin are 0.6 gram. All of these are 1 day's dosage. People can separate 3 times and take that. Okay.
Do you usually like to have them take the herbs before or after meals?
After meals, the same, about 1 month. About 1 hour.
1 hour after a meal.
Yes.
And if they're on a lot of meds, do you ask them to take it about 2 to 3 hours apart from the Western medication?
Actually, just like I said before, until now, there's no one can really clearly identify Western and Eastern medicine combine what will really happen in people's body. But we have known some kind of the medicine. If we put the Eastern and Western medicine together, can make some medicine stronger or can make some medicine weak. So most of the time, I suggest patients they can separate the 2 kinds of medicine about 1 and 1.5 hours. Separate two kinds of medicine. Yeah, no matter which one can take first.
Okay, so going back a little bit, let's discuss first, Dr. Lin. Can you tell us what is your diagnosis of this patient? From what I'm hearing, is it yin and blood deficiency, cold and damp in the channels, and with a little bit blood stagnation? Is that correct?
Yeah.
Okay. Now, how did you come up with the cold and damp for his diagnosis for the pain? Because his joints feel very warm, and also his tongue showed the dampness.
Yeah. Okay. Yeah. Sorry. Go ahead.
Yeah. So can you tell us from what you were asking, the questions you're asking, how did you come to that diagnosis? Okay.
First one, about the yin and the blood deficiency, especially in the heart. The evidence Diego proved are the first one recently about 1 month. He feel more dream and especially he can remember and he noticed, right? And the second, he also feel his notice and the memory become worse, drop. Yeah. Most of the time, people have the symptom like this combined together. You can see patient has the obviously heart blood deficiency.
Heart blood deficiency.
Yeah. And actually, I think the Diego also have some has some problem around the liver blood deficiency, but there is no enough evidence to prove it. I just think about this because I cannot get more enough information about this aspect. So I only give him the 当归尾. And combine 桂枝12字母汤, there is a 白芍 in there, and there is 地黄 in 炙甘草汤. So it's almost like a 四物汤, right? So I don't give him the prescription just focus on liver blood deficiency, but the prescription, I said the prescription like this. Actually, there's a meaning. I concern about blood deficiency in this prescription as well.
Okay, so if the symptoms he present are more heart blood deficiency than liver blood deficiency for sure. So why did you pick 炙甘草汤 versus 桂皮汤? You were addressing the heart.
Yeah, because the 桂皮汤, if you see the ingredient about the 桂皮汤, is focused on 2 main parts. First one, the GI function, and the other one there are some single herb can supply the heart blood deficiency, but the 桂皮汤, the main purpose of using of the 桂皮汤is patient's GI function is really got some problem, weakness, and combined with the brain overuse of the brain. So in that condition, I will pick up the 龟皮汤 for the main prescription, for main formula.
Yeah, he has no problem with digestion. Yeah.
Yeah, I think most of the time it's okay because his poops and pee are okay, right? And I check his tongue from the picture. There's a little bit a depth on the tongue, and a little bit, the teeth compression, the phenomenon on the side of the tongue, just a little bit.
Mm-hmm.
Yeah. So I think if we like to discuss about the GI problem from Diego, I think the most important one is the low temperature food, the diet habit. Yeah. So that one will connect to the cold issue.
Okay. Yeah. Okay, that makes sense. Thank you.
Yeah,
Thank you for the explanation of 炙甘草汤 versus 龟皮汤. That's great to know.
Yeah. Okay. Good.
And then the next one is the damp cold for his pain. He said he has so many pain, right? You were asking him whether it's a degenerative arthritis versus rheumatoid arthritis. You asked him a lot of questions about, when he has pain and what kind of pain. Does it worsen in the cold, remember, or in the rain?
Yep.
Do all of that make you come to the conclusion of the damp cold causing his B syndrome?
Okay. Yeah. Actually, I asked Diego, did he can identify, or his doctor told him what really the diagnosis of the arthritis? Because I just like to make sure in the Western medical system, what did they do for Diego? And this is the first one. And the second, actually, the degenerative arthritis, the clinical symptom is a little bit different from rheumatoid arthritis. Okay, so rheumatoid arthritis is a symmetrical happen, and morning stiffness, and if patient do the blood test, many patients can get the abnormal data of the RA factor. So you can check the two different kind of arthritis on textbook or online information. You can find there are some different symptoms between these two. So first one, I like to make sure does Diego know about this, and make sure what symptom he really got. Okay.
Yeah, because some of my teachers emphasize it doesn't matter what the Western diagnosis.
Yes.
You still have to figure out the Chinese medicine diagnosis. Yeah. It doesn't matter if it's degenerative, rheumatoid, or whatever kind of arthritis.
Yeah. I know your point. So I just say this is the first part. Okay. The second part, just like you say, actually, the diagnosis evidence or the theory between West and the Eastern medical system are different. So just like you say, the arthritis, many symptoms like this or belong to this. If you make a diagnosis, make a definition from West, right? But in our theory, in TCM theory, we most of the time we say that B, just like you say, right? B symptom. So the B symptom, just like Yellow Emperor Canon, it also it say very clearly the wind, the cold, the damp can make the B happen.
Right.
And no matter from wind or cold or damp, they are different symptom dominant between these three kinds of the B, right? So if you ask a patient the different, you just like to make sure the symptom the patient have. In the process, you can identify the arthritis or the B belong to, more close to wind or cold or damp. Okay.
In this case, damp is clear, right, from his tongue.
Yeah.
But the cold, how is cold clear? Is it because you ask if it worsened during the cold weather? Because his hands feel very warm.
Yeah.
In this case.
Okay. Most of time, this is I think this is the one of the clinical performance you need to focus on. I mean, you need more precisely identification, just like this. Patient, if a patient got a cold symptom, cold problem, actually, not every aspect of the symptom can show the cold performance.
Okay, that's why it makes clinical practice so hard.
Yeah,
We're not as experienced. We don't know which one is the key symptom.
Actually, you can ask a patient. For example, you can ask just like I asked Diego, is the temperature drop or is a raining day make you feel worse?
He did say yes. For both.
You can check the answer from patient to make sure the B, this problem more close to cold or wind or damp.
Sorry.
It's okay. Go ahead.
So the two questions you just asked are very important then. Does it worsen with cold? Does it worsen with rainy weather? The answer to that is more important than how his fingers temperature feel and how he says he feels hot all the time. Is that correct?
Yeah, actually, it's sometimes you can see this one is a evidence to just depend on patient's feeling change because of the weather or humid. Sometimes if patient can tell you, oh, okay, when the weather drops, I can also feel my fingers cold as well.
Oh, okay.
Then you can get more evidence for the cold.
Right.
Yeah, but you cannot ignore if patient very clearly tell you, okay, when the temperature drop or when the climate become more humid, it seems like the symptom become worse. Even patient tell you a little bit, you need concern about this, and you can adjust the dosage or the formula in the prescription, but you cannot just ignore this difference. So that's what I mean. I just like to say, okay, even Diego's arthritis, the B, if you compare with the wind, cold, and damp, maybe more damp and less the cold, but you cannot ignore the cold factors, the factor. And also you need to put some single herb or formula in prescription. And you can adjust the dosage.
You also ask if the pain is worse when you wake up. So is that just to say that, when joints are not moved for a long time, there's not enough blood circulating to it, or perhaps there's some blood stasis in this case? That's why the joint pain. So that is to ask whether they have good circulation or not, correct?
Yeah. Actually, not only about this, but also you need to pay attention on. Diego also mentioned not only wake up in the morning. If he keep the same posture, he's in a stable condition for a period of time. When he start again to move, he can feel that, right? So you know what? At the first, in the second part course, I just talk about the musculoskeletal problem, right? Most of the time, even people have no arthritis problem, but if people got the muscle tight or bone structure misalignment, in all the condition, the blood circulation or the nerve innervation be compressed. People also can feel that problem, numbness or sore or pain, maybe weakness. They cannot take the heavy thing. Okay, but that's not arthritis. If you can adjust the bone structure and move the muscle, move the muscle high tension back to normal, and no matter you do the manual treatment or acupuncture, that will helpful.
Yeah, okay. So, excuse me, I'm going to ask Dr. Lin a question in Chinese, okay? 但是我看那学生啊，他们觉得这个 case 还蛮难的，因为只要变那个冷或热啊，就有点难了，因为这个病人他就说他很热嘛，然后我们如果又放附子进去的话，他会不会变更热？就是说他这些 symptom 是哪几个 symptom point to 一定是 true cold, you know, 而不是说像这个学生说的，他是 false heat, 但是是no, sorry, false cold, 但是是 true heat. So I just asked Dr. Lin, you know, this case is pretty complicated to help us better understand, to just make that diagnosis of heat or cold. I think for me, it's pretty difficult already. I don't know if it is for you guys, because Dr. Lin is using 附子 to relieve the pain, you know. So if this patient really has like heat, then this is going to make him feel a lot worse. So what I just asked him is, where in his range of symptoms did he come up with the diagnosis that he's so sure this is a cold condition?
Okay. Actually, when I was in Taiwan, I still teach in college. Many students ask me the same question. I mean,
hard.
How can you identify this patient is cold, other one is hot, or you know, the question like this? You know, the answer actually is very simple. You can think about this. Even a normal people, the energy distribution in our body is the same. Every part is the same. No, right?
Right.
So you can see, if you have a more experience in clinic, you will see sometimes the symptom, people, maybe there are some part people got the symptom, maybe the performance showed hot, but the other parts are cold. That also means the blood circulation distribution is abnormal. The distribution is not balanced or equal. So you can see some parts hot, some parts cold. Most of the time, the arthritis, just like this, you know, the joints you always feel it's under inflammation. But even the inflammation, we can very simply separate two kinds, acute and chronic, right? If patient have the acute arthritis, of course, you need to use the anti-inflammation drug, no matter east or west, right? But most of the time, if the arthritis the arthritis become too chronic, most of the time, it combines two conditions at the same time, cold combined heat. So you see, I use the 桂枝芍药知母汤. 桂枝芍药知母汤 can treat the two different things combined together. So there is 芍药 and there is a 知母 in this formula. And the 炙甘草汤, there is a 生地黄 in this formula. And I use the 致附子. I use the single herb 致附子, just only 1 gram every day. And Diego separate 3 times to take it. So every time he just take 0.3 gram. So I don't think this formula can make Diego become more heat or feel more hot. Yeah, but I think we just wait and see. If Tina, you give the Diego this prescription, and after he take this prescription about 1 week to 10 days, we can see what happened, and maybe, okay, sure, maybe I'm wrong. I need to adjust the prescription, but in my experience, most of the time, especially in chronic disease or chronic arthritis, you need to keep in mind you will face two kinds of the problem at the same time, cold and hot. Yeah, and why the arthritis from acute become chronic and prolong so long time cannot be dealt with. Right. Because just like I say, if you just think, okay, it's litis, the word ending is TIS, litis. Okay, it's an inflammation thing. Okay, inflammation is very simple. I just give you anti-inflammation or a drug. Right. That's wrong. That's wrong. Just like we got the sports injury, maybe 10 years, 20 years, 25 years ago, we always say, okay, if you got a sports injury, you need the ice treat, right? You need first time you need to do the ice. But now, if you are a sports expert, you will know just only some condition. The sportsman when he got the injury, he needed to do this. But the other parts, there are still a lot of parts you cannot just use the ice pack to treat the acute problem. Sorry, can you hear me? The
Yes.
signal still interrupted. Oh, okay. Yeah, so it's a combination. We will say, oh, okay, Diego's case is so complex because the complex means it's not just really, simple, directly viewpoint can figure out. Yeah, you need to keep in mind there are many possibilities at the same time you need to deal with.
Mm-hmm.
Yeah, so I think the 致富值, I think it will be fine.
So Dr. Lin, if we are not sure if it's cold or hot,
Yeah.
Can we just not use 致富值 and use 盐湖索 instead to relieve the pain, just to be safe?
Yeah. If you are a young young acupuncturist, you are a young
A new practitioner.
New one, yeah. Sorry, not young, new one, yeah. Maybe you can try not only 致富值, you can try another single herb and make sure the dosage that you can control and one by one to treat the patients and gather your experience as well. Then after that, you will know, okay, every herb has different effect for different aspect of the problem. For example, the 盐湖索 and the 致富值 are different kind of the drug herb can treat the pain. So the 富值 is for cold, and the 富值 can the 富值 the effect of the 富值 the speed is very very quick.
Mm-hmm.
Okay, so most of the time we use the 炙甘草 to pour it. Come on, slowly, keep the effect in your body for a long time, for longer. Yeah. So if this patient, the pain feeling is so strong, you like to remove the pain quickly, you can put the 附子 and don't put the 炙甘草.
Oh.
Yeah. That's the company of the herb. You need to regularly, so you need to know many things. Then you will use the herb precisely and just focus on the bullseye.
So you like to use 致富值 to push the effect to the extremities as well as relieve pain quickly due to cold. How much?
Especially the pain comes from the cold.
Yes. How much maximum dose per day is safe to use this herb? Oh,
if you like to talk the foods, I can say a lot of story about that. When I was in Taiwan, I used a lot of foods. Okay, the cooked foods, the 致富值 is different than raw foods, 生富值. Okay.
I don't think 生富值 is available in the US.
Oh, okay. Yeah.
Okay. Anyway, everything usually is prepared already to reduce the toxicity.
Yeah. So okay, I also use the raw foods in Taiwan. So, but okay, actually, just like you say, in here, United States, we cannot use that. So the 致富值, if I use the traditional way, I write a prescription one by one, a single herb one by one, and write the dosage just beside that, just like a traditional list.
Mm-hmm.
The maximal dosage I have used about the 致富值 is about 2两. 2两 is more than 60 grams, I think.
Wow.
Yeah. I think that's a huge dosage, but it's that's for very special condition. The patient got a very serious heart problem and also have the meridian cold, And sometimes when you treat some kind of a cancer, you need that.
Okay.
Yeah, but most of the time we don't need the so huge dosage. You know what? The clinical practice is not a performance, it's not a commercial performance. Yeah, you just need to focus on patient's condition. This patient, I need to use how much. That's why I need to use how much. It's just because the difference of the patients, not for your self-commercial performance. I don't think so. Yeah. So the common use dosage about the 致富值, if we use the concentrate herbal powder, most of the time I use the range I use from maybe 1 gram to 2 gram every day. Yeah.
Okay.
And if you use the herb, maybe it's to maybe 6 gram to 15 gram every day, I think.
So 1 to 2 grams for extract powder, 6
Yes.
to 15 for raw.
Yeah.
Okay.
Yeah,
And
that's most of the time I use it like
okay.
this.
And to conclude the class, Dr. Lin,
Yeah.
can you tell us what acupuncture points you will use for this patient and why?
Okay. Just like I say, set up the prescription, my thinking process. First one, Diego has the blood and yin deficiency, especially in heart. So I will give him if I do acupuncture, I will give him the 内观.
PC.
内观. Yeah. I don't know how to say 内观 in the number system, because in Taiwan we don't use the number. So
okay. We don't really know either. We know the number.
Okay, good.
So we'll just type the pin in. We'll look it
Okay,
up.
good. Okay, so for the blood deficiency, I will give the 内观 and the 血海, and on the acupoint on back, maybe I will give him the 心腧 and 肺腧. Of course, if you put a needle on the upper back, you need to watch out the depth of the needle. Don't put the needle too deep for safe. Okay. So for the heart related issue, first time I will give him this acupoint. And about the pain of the of the joint or muscle, I will give him the do you know the 大柱? It's on the back, on the spine. We say the 骨会大柱. The bones problem, we will choose that acupoint. And the muscle issue, I will give him the 阳陵泉 and the 阴陵泉 together, and combined with the 足三里 because of his GI, the cold issue. And the last two acupoints, I will give him for the kidney meridian, the 太溪 and the 复溜, because if I can make the kidney meridian stronger, it will also help for the liver meridian and the heart meridian as well. And at last, about the low level of the oxygen, I will give him, maybe I use 合谷, maybe I use the 尺泽 for his lung problem. And all the acupoint I said, maybe I don't use all of them together at one time, because in my opinion, I don't like put too much needle on patient's body at the same time. Because don't forget, I said that one needle, how about 干扰 in English?
Disrupt.
Oh, okay, yeah. So one needle, one interrupt. So if you are not familiar about acupuncture, every needle you put it into people's body, you interrupt the energy circulation as well. So make sure you are familiar, no matter the manual treatment way, the manipulative way, or the acupoint property, and make sure your diagnosis before you do the treatment. Then the things you do for your patient will close to the truth, and that's the way. That's a good way for your patient.
How many needles do you use, Dr. Lin?
Actually, when I was a medical student, my teacher asked us, every patient come to your office, every time, you need to do the 3 to 5 needles to deal all the problems.
Wow.
Yeah.
Here's
So yeah, we just under the training about this. So we still now I try my best keep my needle number under the 5.
Wow.
Sometimes we're over the 5, but I just try to my best not to do this.
So Dr. Lin, if you're doing 5 needles only, these points, are you doing them bilaterally or just one side?
No, always, most of the time, I choose a special side for special point, acupoint. For example, I always do the 内关 for left side. I always do the 合谷 for right side.
Oh, okay.
Yeah. I most of the time, I always consider about the qi and the xue, the different distribution in our body at the same time. So in my habit, special point, I will choose a special site to do the treat.
Okay, so is this correct in saying if you want to treat qi-related problems, you usually will pick the points on the right side, and if you're treating more blooded in, you pick the left side points?
Yeah, most of the time I do this.
Can I ask also what gauge you use? If you're only using 3 needle, are you using gauge 30, really thick needle?
Actually, most of the time, if I really do the treatment for patient, and the patient, many patients have experienced for TCM treatment, so they always say, "Oh, okay, you do the acupuncture for me. The needle stay on the body. It takes 20 or 30 minutes, right?"
Mm-hmm.
Most of the time, people will ask you to do this, but I try my best do not follow this rule.
Oh.
Yeah, because in the traditional way, in the Asian book, some book tell you when the patient be treated. I mean, after the treatment, the pulse taking be changed, the people's condition be changed, you can remove it. Yeah. So just like Lin Shu, this book, Lin Shu write very clearly before you do the acupuncture, you need to take a pause to make sure you need to make a diagnosis, make sure what really happened in a patient's mental and physical, right? Then when you do this, when you know about this, you make a diagnosis, and then you set up the strategy of the treatment, right? So you write down some acupoint for patient. So when you do the acupuncture from this acupoint, you finish the manual treatment, you finish the process, you need to take the pulse again. Mm-hmm. When the pulse be changed and the performance become better, actually you can remove all the needles. Mm-hmm. That's the general principle about acupuncture treatment. But just like we discussed about Diego today, actually every people in clinical practice is different. So the principle is there, but we need to know about this, but we need to comply all of the real people show up to you. So if the patient, for example, if I do the treatment, acupuncture treatment for Diego, I will stay the needle for his body for a long time.
Why?
Because this is a chronic problem.
So long time is how long?
Actually, I do not really do the diagnosis. I cannot make sure, but at least 15 minutes to 20 minutes.
15 to 20 minutes is a long time.
Yeah.
Yeah. Usually we are trained to always patients 30 minutes in
Okay.
for the retention of needle, sometimes 40.
Yeah.
So,
I
okay.
know.
So you're talking about immediately removing it, maybe within 5 minutes.
Yeah. Actually, 50 to 20 minutes, just, it's the same like example. It still depends on different people's condition. So the principle is the people, you know what? You can check all the rules about the question you ask from Neijing and the Nanjing. There are many chapters discuss about this. This is first one. Second, the 15 or 20 minutes is just like example I said. Mm-hmm. Actually, you need to check the patient's condition. For example, if I do acupuncture, suppose I think, okay, 15 or to 20 minutes is good, it's enough for Diego. But after that, I check his pulse. Oh, come on, it's not go back normal. Still not. No, I will stay the needle longer.
I see.
Yeah, so it depends on. And one more thing, not only the stay time of the needle. When you do the manual way, the treatment way, you still identify the patient's condition to make sure you needed to do the 补 or 泻, right?
Mm-hmm.
And and the 补, how strong the way you do. The 泻, how strong the way you do. You need, it's not the SOP. No, there's no SOP in our clinical experience. Okay, maybe you got some experience from the book or from the other doctors, but that's just a principle or experience comes from them. You need to establish your experience by yourself, and all experience comes from your patient. So you should be honest to your patient. Okay. So when you do acupuncture, do any treatment for your patient, you can stay some knowledge in your brain, but you cannot just follow the knowledge you know. You need to make sure the really performance show up to you. The patient, because the patient just in person in front of you, right?
So Dr. Lin, in this case, Diego's left pulse is virtually not there. If I needle his pericardium 6 and spleen 10, should I expect the pulse to come back maybe in 5 minutes and then I can remove the needles?
Actually, I'm not sure if you do this to acupoint, the pulse how much the pulse can show. Okay, but if the phenomenon like you say, you do this to acupoint after this two treatment about 15 to 20 minutes, the pulse can show up more. Mm-hmm. That also means the treatment is right. You do the right thing. Yeah, so, and how long you like to keep the needle stay in his body, you can make decision by yourself. And for sure, you need to also ask Diego's feeling. Do you feel better or do you feel comfortable? Mm-hmm. And make sure what do you do next step?
Okay. Yep. So theoretically, I'm thinking because Donna needles him, if she needles these 2 points and also the back shield points of the lung and the heart, supposedly, okay, after 20 minutes, the pulse comes back and then you remove the needle. 5 minutes later, 10 minutes later, the pulse disappears again. So in that case, would you needle the patient again, let the needle retain for another 30 minutes, or tell him to come back tomorrow? What is a better solution?
Yeah, you point a very important and interesting question, because if you practice every day, you will find the same problem just like you ask. Mm-hmm. So most of the time, the principle is when I do the acupuncture, after I do the acupuncture, I take the pulse, I can find the pulse performance really become better. Actually, I remove all the needle, right? Mm-hmm. But most of the time, if the patient got a serious problem or a chronic problem or complex problem, after the acupuncture treatment, when he go back home, maybe 1 day or 2 days after that, maybe the symptoms seems come back a little, right? So there are many ways many strategy to deal with this. First one, just like you say, you can ask patient come back maybe every 2 days or every 3 days or every 1 week to continue do this, okay? And the second way, you need use another treatment way as well, like take some herbal medicine.
Right,
because you also can check this question on Lin Shu. Lin Shu said very clearly what kind of the condition the acupuncture, the needle treatment can cover, what kind it cannot cover. You need company with the herbal medicine.
I think Lin Shu.
The most important, the most obviously condition is when people got a problem about the qi and the xue insufficiency, the energy insufficiency, the yin and the blood insufficiency. Generally speaking, this patient is totally weakness. You cannot do the acupuncture treatment, or you cannot just take the acupuncture treatment. You can combine with the herbal medicine or diet therapy or any other nutrition supply. This is very, very important and very clearly principle. Yeah. So if the Diego condition, just like you say, every time after do the acupuncture treatment, he will be better. At least the pulse taking it can show better. That's good. That also means you do the right thing for the acupuncture treatment, right? But if the further change, just like, okay, maybe you do the acupuncture, you remove all the needles about 1 hour or maybe half hour, the pulse back to the weakness. Now you need to know. You need to keep in mind, okay, Diego need another treatment, another way of the treatment at the same time, especially maybe diet control, nutrition supply, and herb treatment.
Okay.
Yeah.
Okay, and then there's one question in the chat room. Dr. Lin, do you do tonification and sedation and needle different than what's taught in the textbooks?
Actually, first one, I study the tongue diagnosis from textbook, of course. When I was
diagnosis 是那个补跟泻，穴道的补跟穴。
OK。
你有没有一个 special method， 还是跟书上就教
？OK。About the 补 and the 泻, most of time I follow Lin Shu and Nanjing, these two important books. Yeah, so most of the time I do the 补, I turn the needle in clockwise direction, and the 泻 is opposite. Okay, and I put the needle in and out in the different speed. You put in slow and put out fast is 补. The opposite is 泻. And sometimes I also accompany with people's breath in and breath out. Breath in, you put a needle in, is 泻. People breath out, you put a needle in, is 补. Okay, it sounds so complex, right? But you can check them on Lin Shu and Nanjing.
Okay.
Yeah, very clearly.
Okay, and then next question is, the pharmaceutical medications that he's taking should change his pulse. Do you ever take that into consideration? 就是他吃的西药啊，可能会 affect 他的那个脉象嘛。
Actually, I have a little bit experience about the West drug affect the pulse phenomenon. I have a little bit experience about that, but there are too much Western medicine people always take, especially Diego seems take so much medicine. So actually, I cannot answer this question very completely. Okay, but in my experience about, for example, about the aspirin, people take the aspirin for a long time. The pulse, the phenomena, the performance of the pulse, sometimes you can feel is just like very sleepy. Okay, 滑是 sleepy, right?
Slippery.
Slippery. But if this patient combined with some medicine can drop the blood lipid. Many medicines name end with the statin. S-T-A-T-I-N, right?
Right.
Most of medicine name that can drop the blood lipids. Most of the time, people got the high blood pressure and high blood lipid. They can take the medicine combined together. Most of the time, people you can see people's pulse become a little bit weak, 缓慢.
Weak.
Yeah, weak. Yeah, and when you push down the pulse, you can feel just like there's nothing in the vessel, just like empty. 有点像抠脉. Yeah.
Like the scalene empty in the middle.
Yeah, like garlic too. So actually, I have a little bit experience about this question, so I cannot answer this completely.
Okay, that's okay. 那还有一个人问说，when we're doing the abdominal palpation, 病人的腿是直的吗？
Yeah, actually, I will when I do the belly checking, I will ask a patient change the posture. First time, I will ask a patient straight their legs first and check the belly and chest. Sometimes because the patient's belly tension too high, or they have a big belly, so I cannot check. I cannot just hear the sound very precisely. So I will ask patient bend their knees and make the tension of the belly become loose. Then I tap the belly again. I think that's more detailed and more correctly.
Okay.
So if I ask patient straight or bend, it depends on patient's condition and the result I check.
Okay, and the last question. Do you have any recommendations for the patient in terms of diet or gentle qigong or tai chi? What kind of exercise?
Okay. Actually, if you like ask the patient in here in United States to follow your health education, sometimes it's very difficult. Yeah. People always busy, always like eat the thing they like, or live the style they want. So most of the time it's very difficult. But it's not only here in Taiwan; it's the same condition. Okay, so sometimes you can find even you spend a lot of time to tell patient many stories, many concepts, many principles, and ask them to comply.
They don't.
Yeah. Maybe they just can do half. Okay, but if a patient can come back to see us again, please remember you just like an old mom, repeat again and again. Okay, this is first. Second, about Diego, the things I like to let him know. Just like the first part, I told him first one, the diet temperature is a very important issue. Yeah, this is the first one problem in my clinical experience. I find many people got some tissue problem or a blood vessel problem, or the 5-man visceral or 5-man functional group problem, many problem comes from the long time incorrect temperature diet.
Mm-hmm.
So the temperature is the first thing. Second, just like we talked last time, the liquid and the water or any liquid intake is also a main issue people need to focus on. So make sure the quantity of the water is suitable.
Mm-hmm.
Every day people take.
Right.
And the third one about the Diego, I like to ask him to take the the fresh food. Fresh food that means the seasonal. The fall season have different kind of the agricultural product, right? Mm-hmm. So make sure the things you buy just in this season and the local. Yeah, try your best. And cook by himself. Yeah, try his best. Cook by himself. Okay. Because if you always order the outside food, I'm not want to say all the restaurants are not good, but just like we know, business is business. So restaurant is a business. So the owner will calculate all the thing about this. So if you can buy all the things yourself, local in this season, and cook it by yourself, in the health condition, you at least you can make sure the baseline of the health. And another thing is sleep. So the bad quality of sleep can make the heart condition worse. So actually, I give Diego the 炙甘草汤 is another there's another meaning for his sleep, the quality of sleep. Yeah. Okay. The yin and the blood deficiency can make the quality of sleep bad. Of course, the pain makes him feel he always keep alert, cannot fall asleep as well. So back to the topic we just talked about, how can involve Diego's problem in today, the first visit. You need to increase his quality of sleep and decrease the pain feeling. Okay, so the temperature, the quality of food, the quality of sleep, and the last one, the exercise. I think the first visit, I would like to give him the health education around this.
Okay. Yeah. All right. Thank you very much, Dr. Lin, for all your wisdom and sharing your clinical pearls with us. I think everyone learned a lot today. I learned a lot from you every time.
Thank you so much.
Concept and knowledge for us to use as guidelines in our clinic to decide what to do. So
yeah, I hope my tiny personal experience can give you guys more help. Yeah.
Thank you very much, Dr. Lin. Dr. Lin is practicing in New York now. He practiced in Taiwan, I don't know, for the last 30 years or 20 some years. And he just recently moved over. He moved over when actually COVID hit. So
yeah,
it was a rough time. So I don't know if Dr. Lin is ready, but I would love to see whenever he's ready to take interns that we can go to his clinic and learn directly from him in the future. But in the meantime, if you have any questions, feel free to email me, or Dr. Lin is also active on Facebook too sometimes when he has when he has time away from his clinic, answer questions. But hopefully we'll see you in the third class next month. Same thing, we have another case, and it's going to be a complicated case as well. So happy learning to everyone. So now back to Donna. Thank you.
Okay, thank you.